Hi, Glenys.
Hey, Aaron. What do you want to talk about today?
How much I hate diets.
Yeah, diets suck.
So what do you do instead of a diet?
Intuitive eating. Health at every size.
So how many times have you had to explain intuitive eating and health at every size to someone?
Like 5,000 times. But that was just to my doctor.
Okay, so how many times have you explained it to someone and then they said, but diets are the only thing I know?
That's like every time. Can we pursue health without thinking about weight?
Yes, we can pursue health without thinking about weight.
That's pretty revolutionary, what you just said. But what if you just don't like yourself at the size that you're at?
I think we need to understand why, instead of just saying I need to change.
So, what's the deal with body positivity?
Oh man, that's a long answer. I'm Aaron Flores.
And I'm Glenys Oyston. And we are Dietitians Unplugged.
Hey, Glenys.
Hey, Aaron. How are you doing?
Good. It's good to finally be back and recording another episode with you.
I know. I feel like it's been forever since I last talked to you.
I know. Well, that just means there's more like greatness in store for us to discuss.
We're coming out with this like amazing episode. We're like, we've been away a little bit, but boom, here it is. This is
bang, right? Yeah.
All this awesomeness in one episode. So what have you been doing? Why are we so busy that you can't talk to me? Because I'm hurt. I'm
trying to make up a lie that it's like, actually, my therapist told me I needed to set boundaries with you. But that's
what's her name? No. I'm gonna find her. No.
Yeah, it's Larry. What do you mean? What?
Oh, sorry. Yeah, I don't know why I went right there to what's her name. Cultural conditioning.
Listen, the honest part is like we actually had a great group of episodes and we got so excited we released them all back to back.
Yeah.
And the awesome, and so it just took us a little bit of time to get some free time again to schedule some new episodes. Listen, I all the same stuff is going on. I am at Center for Discovery and our binge eating disorder program is going really well, and we're continuing to really do some amazing things with that just across the whole nation, and to be a part of that is great. And my private practice is going really well. The clients that I have we're doing amazing work, and I'm always looking to expand that. And there's always space for new clients. So, it's a lot of the same stuff, but it's just all just going really well.
Awesome. That sounds great. Yeah, I've been extra busy the last few months too. One of the things I did along with our friend Rebecca Scritchfield of the Body Kindness book is we got together and decided to launch some groups, virtual groups for people with diabetes, people with prediabetes or family risk, or just general worries around blood sugars. And we've run 3 cohorts now, and they're really small groups. We have about 6 to 8 people, so it's really focused. And it's been amazing. Like what we have learned from people has been amazing about what their fears are and what's stopping them from taking care of themselves with diabetes or blood sugar concerns. So this has just been something kind of amazing that we've done. I mentioned a few episodes back, if you we're kind of doing this secret thing, which we hadn't quite launched yet. So if you had concerns about diabetes, to email me. We have now launched it, and we've done a few groups now, and we're taking just after this one a little break, and then coming back in the fall with new groups. And it's just been really gratifying to use all my education around, and practice of educating around diabetes with people, and bringing in some new components from a health at every size perspective that people have never heard before.
Awesome.
Yeah, and so I'll post the link to that in the show notes, just so people can register if they want. Registration is open, but it's for the fall. But I'll put it in the link just so people have it, and we hope to have some more awesome groups soon. So yeah, so that's what's been going on. So I've been getting more into diabetes, which is kind of funny because it was not something about a year ago, if you'd asked me, I was going to focus on. It never occurred to me until a few people said some stuff to me. It's like, we need more HAES practitioners focusing on diabetes. And I was like, oh, yeah, that's a good idea. We talk a lot about, intuitive eating and just the basic problems that people have. And I think they just assume like we can't address medical conditions from a HAES perspective. And that's not true, which is why we're having Megrette Fletcher on today.
Yeah.
Who is somebody who is doing that. She is talking about diabetes education from a HAES perspective.
Yeah, no, I think I was very excited to hear that she was coming on the show, and she lived up to the expectations, and what she shared with us is really amazing, and I loved so much of her language and just her approach to this work.
Yeah, I think she gets at the core of what we need to be doing with diabetes, working with clients with diabetes. And it's not what you think. It's not just giving nutrition education and being done with it. It's far from that. So we really got into the nitty gritty, but I'll read her bio. So you know who she is and who we're talking about. Megrette is a registered dietitian and certified diabetes educator who has worked in diabetes care since 1995. In 2005, she co-founded the Center for Mindful Eating, and she'll talk a little bit more about the Center for Mindful Eating during our interview. And in addition to offering webinar trainings about the scientific benefits of mindfulness and health, Megrette has written 5 books for professionals, including one of our favorites, which is Eat What You Love, Love What You Eat with Diabetes with Dr. Michelle May. And that book's not just for professionals, it's for consumers who need to know more about how to take care of themselves with diabetes. She currently runs a Facebook group for HAES professionals, which I am in, called Weight Neutral for Diabetes Care. And it's a great book. If you're a professional who wants to know more about how providing weight neutral care for people with diabetes, this is the group for you, and we'll post a link to it in the show notes.
Awesome. I think it's going to be a conversation that's really it's well worth the wait, folks. So you're gonna love this one.
Yeah.
So without further ado, here's our conversation with Megrette.
Megrette, welcome to our show. We're so excited to have you here to talk about something we haven't really talked about on our podcast before, which is diabetes. And we are so excited to have you here because we know that you are a CDE and a certified diabetes educator, but also you're a non-diet person. You're like one of us. So we're happy to have you here today.
Well, thank you. It's a joy and an honor, and really exciting to be here as well.
And you are very based in sort of a health at every size practice. So I think this is something that people don't hear enough, and that you don't have to diet to help manage your diabetes. And we'll get like deep into that. But I wanted to sort of start out with asking you about how you came to sort of focus on. You're big into mindful eating. I know that, and you're CDE, and you kind of promote mindful eating for diabetes. And so I just want to know how you kind of came to focus on that.
And my question is like, which came first? Was the mindful eating there first, or was the CDE there? So I just add that into your description if that's okay.
Sure. So I think my background is I used to work in diabetes care. I used to work as an eating disorder dietitian, and when the eating disorder field changed and it really wasn't getting reimbursed, I chose to change careers and work with diabetes because I wanted to have a relationship with my clients. And so since 1995, I've been working with primarily diabetes patients. And in 2000, I only worked. So since 2000, I've only worked with people with diabetes. So all of my clients have always had diabetes.
And when did the mindfulness start for you?
So mindfulness is kind of an interesting thing. I think we reach out when we're struggling. We reach out to say, like, how can I cope in a way that doesn't cause other problems? So I had some personal issues that I needed some help with, and I turned to meditation. And I started meditating, kind of dabbling when I was in high school, but when I was kind of struggling personally, I really committed to a regular and consistent meditation practice. And that was in 1999. And, as I meditated and really made that commitment, everything started shifting for me personally, but also professionally. So I've only worked with people with diabetes and the mindful eating. I've never actually worked, in a paid professional, arena with people that weren't struggling with diabetes. And so my bread and butter job is bringing diabetes care and mindful eating and mindfulness and health at every size to people with diabetes and prediabetes.
We love that. That's it's so needed, right? Because the standard advice given to people when they have either prediabetes or a new diagnosis of diabetes is lose weight, especially if they're in a higher weight body.
Yeah. So, before we hit the record button, you and I were talking, and I have my little soapbox, which is it's hard for people to understand the scope of the problem. So in the United States alone, and it's really important to recognize that there's no place in the world where people are not touched by diabetes. So there isn't some secret little country where diabetes doesn't happen. It's a global phenomenon, and it's a problem in every single place in the world. So every country, every inch of this universe, of this world that we live in, is touched by some sort of abnormality of blood sugars. And in the United States, it's 100 million people. And that's really hard for me to get into my head that it's so many people. But it's a pandemic, and we need to recognize that what we're currently doing, it isn't working. And that's really important. And why isn't it working? Because restrictive eating doesn't work. It's not sustainable. And people cannot be afraid long term. That's just not a sustainable position. It's unfair for us to ask people, "Oh, by the way, you're 40 years old. I'd like you to be terrified for the next 40 years of your life." It's not fair to ask anyone to do it, but you can't do it, and you become apathetic. I mean, you just say, "I just can't deal with this anymore. I'm just going to ignore the diabetes." And the moment that happens, that's where I think real illness sets in. If you and I talk and you go, "Oh, well, you're not going to judge me. You're going to listen to what I have to say." Well, I'm a heck of a lot more interested now. Like, I'm actually kind of riveted.
Yeah.
And then you start offering me some, you listen and you say, "Well, what would work, Megrette?" I'm like, "What? Excuse me, Glenys, what did you just say? What would work?" It's a very different conversation.
So, I mean, one of the things that resonates with me there is the notion that, like, of trying to make choices that are rooted in compassion and non-judgment instead of the dominant narrative, which is very shame-based and fear-driven. And I think, whether we're talking about diabetes or eating disorders or whatever issue we might be working as clinicians, right, is that shift in conversation is very important for us as clinicians. But I think even more importantly, the person who we're working with actually notices a complete difference in that relationship that's built with in the room, that again makes the definition of work very different. One other thing I wanted to say, so many of my clients, it's not just when they're 40 that they're scared. They're like scared at 20, and they're scared at 30 and 35 and 37, like of having diabetes when they're older. And like the fear just starts so early. And that's so sad to see how much that plays into people's lives from a very early age.
It's amazing. And I love everything you said about just changing that conversation and changing the tone of the conversation. And fear is, our brains are hardwired to be afraid. It really gets our attention. The joy doesn't get our attention like a little bit of fear does. And shame is something that we inherit. So we experience shame, and it's very painful. It's a universal experience. Again, like diabetes, everybody has experienced shame. You can walk down the street and just think like, oh, that person has it, and that person's had it, and that person's had shame. Mm-hmm. And so in this universal experience and how powerful shame is, it's often used to motivate. Now, I know the research shows shame never motivates anybody, but because it's how we're taught, it's how we teach. So if I learned by being shamed, and as painful and as unproductive as that learning was, I am like 99.9% more likely to teach by shaming because that's how I learned. And until you learn another way, you do what's familiar.
It almost sounds like patterns of trauma that just keep getting perpetuated from generation to generation.
I think diabetes has a lot of trauma to it, so I would agree. And I think that it's habitual. We keep doing, like, my mother was afraid, she shamed, my father, so I'm going to shame, he shamed me, I'm going to shame my kid, you know what I mean? It just, like you said, it's that pattern. And diabetes runs in families. And, so many of my clients kind of look back to when they were kids and they say, oh, I remember when my grandmother took shots and she would eat the cake, and I told myself I'd never do that. And look where I am right now. And, they're feeling like it's a broken promise to themselves, which there's a lot to unpack there. There's just a lot to unpack. And it is through compassion that we get to that place of understanding. It is through compassionate listening that we get to that place of choice and options.
Mm-hmm. Absolutely.
And I wonder if part of removing the shame too is just reminding people that this is a human disease, this is a human condition. I don't really like to use the word disease around it. This is a human condition that affects, like you said, in the US, 100 million people, like basically a third of the population, blood sugar abnormalities, and that it's not something that people bring on themselves. And I've seen some interesting research around, like, diabetes affects a huge number of people in India, and it'll affect people in the same places where people are basically starving because they don't have enough food. And the people who are starving will also have diabetes. So we don't know. It's not, this sort of disease of excess that people are trying to promote. So I think there's just so much negativity around this condition that is not true, right? That gets brought into the story. Right. And we don't know enough about it.
Well, you just touched on something that I think is really important, and it's a little bit of a pet peeve of mine. So if it's okay, I'd like to just kind of expound upon that. And I can give you the research and the studies and everything else, but the problems associated with diabetes have been oversimplified to the point of inaccuracy. So like you said, it's a disease because you ate too much. I'm like, no. There are 8 core defects with type 2 diabetes. This is not, none of those core defects, like your kidneys reabsorbing glucose at a higher rate or your liver secreting glycogen when you don't need it. They have nothing to do with what you weigh. And this is a they're defects that are very complex. And again, if we don't seek education, we can't really understand the complexity of type 2 diabetes. And if you go on the internet or you read the back of a cereal box, you're really not getting the whole picture. You're just getting misinformation. And it's so frustrating, for my patients and for me and for you and for everybody.
Yeah. Some of my clients have just said, like, I'm shocked that this happened to me. And it's like, well, this is actually a really common thing that happens. And it's not, I think they're shocked because they think, how could I get this thing? And it's like, well, this is just a thing that we get sometimes, right? Like this is a part of the human reality. So there shouldn't be shame attached to it. And unfortunately, like you said, there just is, and it's not helping anybody.
Yeah, and I think the driver of that shame is, like Erin had said, somewhat familial. It's common, but the driver of the shame, in my opinion, is misinformation. And it's misinformation to sell a product. It's propaganda. And I'm very clear that when you look at where is this, information coming from, there's almost always a product or a pill or a something attached to it. And that's really hard for me because it's not okay to deceive.
Yeah. Yeah. And I'm wondering if, I've talked about it in different groups with other professionals. Over the years, they've lowered the cutoffs for what prediabetes is and what diabetes is. And I'm wondering if that is sort of tied up, if your thoughts around, is that tied up with selling something out of fear, or is that founded?
Well, the studies are all based on, again, because it's a global disease, what happens is that large populations, so like the UK and Japan, China, the United States, India, we all kind of get together and we kind of share the research. And so that's one of the things that happen. And really what they're looking at is it's complex mathematical problems that are turning around saying, where is the threshold where we see problems occur? And the lowering of the standards were actually done because people were presenting with complications associated with diabetes, but not able to get the diagnosis. And though as emotionally painful as it is to get the diagnosis of diabetes, it does open the gates for reimbursement and for people to access services. So I know it's painful when I say to somebody, I'm sorry, your A1C is 6.5, or, it's really, I know it's hard to really imagine that you now have diabetes. It actually opens up the gate for people to get services, to really start working with an educator, to really meet with a dietitian, because prior to that, Medicare is not paying for those services. Now, I put that little caveat in, there is some changes. We do now get reimbursement for preventing diabetes, but those programs are, I think, very weight centered, and for a lot of people, could be triggering and harming. And so that's tough. So I do not believe that the standards were lowered to sell a product, but I do believe that there are a lot of, when we look at the information on the internet and we look at the tone of that information, I think that it's a fear-based tone, and it's fear to promote, to encourage change, and fear and shame are very closely linked, versus a choice-based approach. So you as a person are bright and able. Let's start there. As a bright and able person, what are my options? Well, gosh golly, I don't know anything about diabetes. I'm going to go talk to somebody who does. I have a really hard time sticking to my intentions. I'm going to go work with somebody or find a program that will help me stick with my intentions, not some pre-printed intention, my intentions, things that I value. As a person, I live in a larger body. I want someone to support me in the space that I take up now. I'm not actually looking for somebody to change my body to promote health. I'm looking for somebody to help me achieve health in the space I'm in right now. So those are the kinds of things that I think we need to offer, and not have those things say that you have to change your body to start caring for your body, or you have to change your body because a smaller body is a healthy body. I think those are inaccurate messages.
That's really helpful information. Thank you.
So, before we go too far, you've done a really great job of, giving us a lot of great information regarding diabetes. So I wanted to just move into this mindful eating part for just 1 second. And my question is this, is how would you define mindful eating? Because and the reason I'm asking this is because it's one of those things where it seems like there's a lot of different definitions or assumptions of what that might be. So in your work, how would you describe what mindful eating is versus like intuitive eating, or some of these other principles which are similar but also different?
Sure. So if I can back up a little bit. So
Sure.
way back when, in 2005, I wrote a book called Discover Mindful Eating. And that book is for professionals. And as I was writing the book and I was trying to find professionals to be a reviewer, because pretty much everything that I do has to go through peer review. And it's very important for me that I use accurate scientific research to back up, what I was doing. And so this is at the forefront, kind of right before the wave of mindfulness started to hit. And in doing that, that process of writing that, I really felt like we needed to have a center because it was just too big of a thing. And so I created the Center for Mindful Eating, and that center really just got a lot of attention. So if you can just imagine, a dietitian in New Hampshire said, I think I'll create a center. And then all of a sudden, the whole world is saying, well, what is mindful eating and what can it do? I, at my computer, at my dining room table, am just feeling really overwhelmed. And though I had 9 experts that were helping me with the creation of this organization, it was just really, really overwhelming to police how people interpreted it. So it became twisted, I think, and it became kind of
Like co-opted?
it got co-opted by the diet industry. And I think because my attention was really focused on the Center for Mindful Eating, I wasn't really looking at the diet industry. I haven't ever really been interested in the diet industry. It's not something that I connect with. I don't really associate with it. So I'm kind of like, I don't know, they're doing something, I'm not paying attention. And so what wound up happening, it really wasn't anything. I didn't really think about it until it was a problem. So all of a sudden people are like, Megrette, you really have to say something about how the diet industry has co-opted mindful eating. And I'm really grateful for the center for creating very clear guidelines that state that they are in agreement with health at every size, that really the center or the hallmark of mindful eating is non-judgment. It is non-judgment. It is really having a practice of listening, and we typically do that through meditation. And then it's focusing on self-compassion. So when you have those 3 things of non-judgment, really listening and taking time to really hear what is present, and engaging in self-compassion, that is going to give you what I call the roots of mindful eating. So, what is mindful eating? It's being in the present moment. That's what mindful eating is. It's turning around and saying, my intention is to pay attention, and my attention is on the task that I'm doing. Now, what does that do when we eat? Well, first of all, we're not distracted. And a mind that's distracted is not an integrated circuit, it's not an integrated brain. And an integrated brain feels good. It's like, oh, that's how my body was supposed to work. So when we're integrated, meaning we have sensory input, it comes into our brain, we can kind of process our emotions, and then we connect it to a thought. That's an integrated circuit. And when you have sensory input, when you eat all the time, and you go, oh, this feels like, or it reminds me of, and oh, I have knowledge about whatever it is I'm eating, you have an integrated circuit. So mindful eating is inherently a pleasant experience, but it's not always pleasant because the present moment isn't always pleasant. Sometimes that food or that situation will connect with feelings and thoughts and emotions that are not particularly pleasant. And it's hard to be present when we're eating. If we have trauma around food, if we have past experiences associated with certain people that we're eating with. So it's really also teaching us to tolerate and really start articulating, where are my boundaries? What can I do? Because I, as an individual, am choosing self compassion. I'm not judging my experience. I'm present for my experience. And if I feel like, hey, this eating situation really isn't working for me, what are my options? This food isn't working for me. What are my options? This moment right now is really not working for me. What are my options? So, mindfulness is coming to the present moment and seeing just that. What are my options? What are my choices in a non judgmental, compassionate way? And the research that comes from when we do that, it is health promoting.
That's great. And so I think that's a really beautiful explanation of mindful eating. I heard about mindful eating through, again, so you talked about how it gets co-opted, right? So what's interesting is I heard most about mindful eating when I was working at the VA in a weight loss program, right? We had a mindful eating group, right? And that's a perfect example of how things get co-opted. But I just want to say that, how we are raised to eat is so opposite of what you're describing that it's truly revolutionary, I think, to just try to have your intention to be present and have your attention to be in the moment. I mean, I think that's just in and of itself a revolutionary practice to come to the table with that mindset.
And that intention. Right. And that empowerment to say, if it's not working, that's okay. With the empowerment, if this isn't working, I get to make a change. If this isn't working, I get to stop. That's really where mindfulness really comes in. And here's the other thing. If it is working, I get to keep eating. I get to do this again. I get to keep enjoying my food. It's not all about what isn't working. A lot of times mindfulness lets us know, hey, this really worked well. Whatever I ate today, this really worked well. Maybe it will work well tomorrow. Not, I have to eat it tomorrow, but okay, this is a tool in my toolbox. It's a flexibility that I think we don't have around food and eating.
Yeah, and I think that non-judgment piece is so important too, which is why I say to people, when people say, well, why can't we use mindful eating for weight loss? And the reality is that when you're pursuing weight loss, that is judgment, right? That's judgment that the body that you're starting out with isn't the correct size, or there's something wrong with it, and you have to change that external shape or size or weight. That is a judgment. And I think that those two things, that's what makes those, mindful eating and weight loss, pursuit of weight loss, incompatible, is the judgment.
I would agree 100% with that. And I would like to add that weight loss is a future space. So that's not a present moment activity. And so mindful eating actually isn't interested in this kind of fictitious future out there. Mindful eating is really interested in the present moment, and it's really interested in crafting and creating conditions that support compassionate self-care. And compassionate self-care is whatever my body is, I really have made a commitment to care for it in whatever size, in whatever shape. I am here for you, body. And that compassion comes from a real commitment to listen, a true commitment to listen. And that's hard because my body says things, my mind says things. I don't want to hear it. I don't want to listen to it. I'm living in an older body, and I'm like, really? I have to listen to this because it's saying things. I'm like, no. I'm like 40. No, I'm not 40.
Our bodies get so loud as we get older.
It really does. My knees, my hips, my head.
Our hearing gets worse, though, so we don't want to listen to it.
What? I didn't get that. Can you repeat it?
I know. It's so true. And so that compassionate listening, really, really, really listening. And I think so many times people say to me, well, like I listened, like I paused, I didn't hear anything. And I go, Yeah, sometimes you have to create a space to really hear, and it's really not just listening maybe once, but listening consistently. What is my body saying? Checking in. What does my body um, want right now? What does my body need? What do I have? Really getting into this curiosity, digging deep, pausing, listening, and knowing that sometimes what we hear is conflict, it's confusing, and it's okay that we see a conflict or we see a dilemma. It's okay that sometimes what my body tells me is really confusing. Mindfulness reminds us just to take a deep breath and give it some time, because if you keep coming back saying, hey, is that problem still here? And it goes, yep, still here. I go, okay. So the last thing we did didn't work. And the body goes, no, it really didn't work. Okay, what are some other options that we could pursue? And you start kind of being with that, recognizing that we're always going to have this conversation with our body. And it's always going to be providing us with feedback, not like I listened once and I'm all done. It's an ongoing process. And that's why we call mindfulness, or that action of listening, a practice. We practice listening, we practice tuning in, we practice paying attention.
I love that. And it's the practice part is so important to me now, because I unfortunately grew up in an environment where my mom used to say, oh, if you're not good at it initially or talented at something, you really shouldn't pursue it. Because that just wasn't going to be something that you could do. And I'm laughing now so hard because, wisdom has taught me that actually most of us are not good. We're not brilliant at things initially. We need to practice. And mindfulness is just another thing that we need to practice.
It is. And I wanted just to add this little kind of radical idea. And you get to do things you suck at.
Yes.
You do. I'm a terrible bowler. A good day for me, I might bowl a 30. And for those of you who bowl, how
30?
really a 30. I'm like, woo!
No judgment, but 30.
I'm a terrible bowler, but I love bowling. I have a blast when I go bowling. I am laughing. Everyone's like, oh my gosh, Megrette, you were the worst bowler. I go, it's still fun.
I own it.
Who says everything you have to do, you have to be good at it? I'm like, where'd that rule come from?
Oh my God, you just revolutionized my tennis playing.
Exactly.
I'm the worst tennis player and I'm not getting any better, and I think I still want to do it.
Exactly. And that's it. We get permission to not be these phenoms. And I meet people and they're like, well, I'm really not good at eating a balanced diet. I'm like, that's okay. You can still have fun not eating a balanced diet. You get to have fun eating, and people are like, what?
Right? It can be fun anyway.
And it should be fun no matter what body you live in or what medical conditions you have. Food should be fun for all of us.
Food should be fun, and eating should be fun. And eating should not be this source, this wellspring of shame.
Yeah, and I think it's sort of the result of living in such a results-oriented culture, right? We have to have results, and I think it scares people away from, like you said, doing things that you suck at, because you don't get results that way. And it's like, oh, or maybe we could just have fun in the moment and not worry about the results.
Yes, I love that. I second that.
Yeah.
Put it on a t-shirt. Let's get the message out.
We've sort of talked about them separately, right? So I think the point of why we really wanted to sort of bring you on is to sort of bring these two things together, right? So can you talk to us then about incorporating, something for most people when they've heard about the medical nutrition therapy or the diet for diabetes is very restrictive. So how do you then bring in something as compassionate and non-judgmental as mindful eating in the treatment of diabetes?
Well, so there's lots of different ways that we could do this conversation. And I recently wrote a book for professionals, And it really offers us kind of a way to think about diabetes. And just to kind of begin with is just understanding a little bit about digestion and what that is. So if that's okay, I'd like to start there and then kind of lead into how we can understand what is diabetes in a broad, kind of basic, simple way. Is that okay?
Yeah.
Absolutely.
Okay. So when we think about digestion and eating, you take an apple and you chew it up, it becomes applesauce. Nothing really has changed about that apple, right?
Right.
And as that applesauce enters our stomach, it's still basically applesauce. It really hasn't changed either, correct?
Yeah.
So once that applesauce enters into the intestinal tract, that's when the magic happens, because we know that apples aren't floating through our bloodstream. It is the component of the apple, and that component would be broken down. It's a carbohydrate, so it gets broken down into glucose. And so that glucose is actually what enters the bloodstream. And I think that that's something that a lot of people get confused about. They're just not really sure what happens. Like digestion happens, but they're not really sure what that is. So all food, if it's a carbohydrate, gets broken down into glucose. All proteins get broken down into amino acids, and all fats get broken down into fatty acids. So these are the things that are floating through our bloodstream. And so what happens is in the body, this energy is floating through your bloodstream, but it doesn't actually have a way to get into the cell. And the mechanism, the primary mechanism to move energy from the bloodstream into the cell is through the hormone insulin. And insulin, if you're curious, it's produced in the pancreas, but insulin is this hormone that's literally going to take the carbohydrates in the form of glucose and move it from the bloodstream into the cell. But when we have type 2 diabetes, there's a defect there, and it's really confusing what's happening. But if we think about insulin like a knife, it can make a little bit more sense. So when we're born, we have this really big, awesome, sharp German steel, amazing knife. And just for illustration's sake, we're going to say that it's 20 inches long. So we have this amazing knife when we're born, but as we age, that knife normally gets smaller. Now, some people, that knife size decreases at a faster rate than others. And typically at the time of diagnosis of diabetes, that knife has now decreased by 50%. So instead of 20 inches, it's 10 inches long. So a lot of times when I ask people, so what do you think about having a 10-inch knife? They're like, I don't know, 10-inch knife seems like a perfectly fine knife size. I'm like, it does to me too. So just because our knife is smaller doesn't mean that our knife doesn't work. But a lot of times with type 2 diabetes, the hallmark is insulin resistance. And insulin resistance is where that 10-inch knife becomes very dull. There's lots of things that cause insulin resistance, including stress, which is why things like meditation are so helpful. But inactivity, illness, infection, poor sleep, some types of diet components in our diets can cause that. But aging as well. But there's lots of factors, and working with somebody to kind of unpack all of that is very, very helpful. And then the last thing is, how much work are we asking our smaller, duller knife to do? And I think that's really kind of coming back to the food and the eating. And one of the things that I talk to people about is the distribution of your energy. So are we not eating breakfast? Are we not eating lunch? And then really giving that smaller, duller knife a lot of work at the end of the day? Or are we distributing the workload throughout the day? Maybe having a breakfast and a lunch and a dinner, or a snack and a lunch and a dinner. How are we asking this knife to work? And I think that the distribution of our energy is very, very helpful to look at, because it can make the workload of our insulin knife a little bit easier to manage and effectively move that glucose into the cell.
That's so useful, I think, for people. When I see my patients at my clinical job who have gotten a diagnosis of diabetes in the past, or even recently, I always ask them, like, how much have you been told about, what diabetes is and how it affects you? And they're like, basically nothing, but nothing they could understand. I think that they were told, they were given a very like physician kind of explanation, which was probably adequate for a professional to understand, but it didn't have meaning for my patient. I think that knife analogy is so great.
Oh, thank you. I appreciate that feedback.
So you sort of use that idea of like looking at it as a knife, and like you said, how much work are we making it do at the end of the day if you haven't eaten all day and then you're having a big meal? Is that sort of how you introduce the ideas of, say, eating a consistent amount of carbohydrates through the day, sort of what dietitians like to call the medical nutrition therapy component?
Yeah, I think for myself, a lot of my patients, when I talk to them about the insulin knife, it really helps them understand, like, why did their provider suggest medication? Or it helps them understand, like, why during this very stressful time are their blood sugars elevated? Or it helps them understand, like, oh, I get it, why my blood sugars after dinner are so much higher than they are, at breakfast time. And so we can start unpacking kind of how diabetes kind of is affecting or is kind of presenting in their body. And everyone's body is different. And so I think as we start looking at workload, that's an important question for people with diabetes. What is the work? What could I do? How could I compassionately help my knife that is getting smaller every day? Work and do the work that I'm asking it to do, which is to nourish my body. And that's not a small request. It's a pretty big request. And I think sometimes we want to nurture our body, which is, what I always think, eating foods for pleasure versus for the nutrients that they provide. And we've already joked about how eating for pleasure and having pleasure in our life is an important, normal, necessary part of life. So when we start getting into the basics of diabetes, I think there's a lot, and prediabetes, I think there's a lot that dietitians and health at every size professionals can really guide people with diabetes on. And the conversations and how we take these kind of rigid, fear-based messages around health and nutrition and diabetes and translate those into a compassionate action and a compassionate behavior, I think sometimes is best done in groups. And sometimes it's best done in groups because we ourselves are just not skilled at being compassionate towards ourselves. I can be super compassionate towards just about anybody else. But when I'm asked to be compassionate to Megrette, that's actually way harder.
That's so true. We're our own worst critics, right? And we have a very loud inner critic voice, which Aaron and I have talked about at length before.
Yeah. One of the things you mentioned, Megrette, just a little bit earlier was, that difficult moment in your sessions where you might need to really talk to someone about, giving them this diagnosis or talking to them about what it means when they first hear it. I'm wondering also how, for lack of a better word, but like the grieving process goes for a lot of those clients too. I mean, like that moving from that space of grieving or sadness or shame to moving to a space of compassion and trying to do something, that is non-judgmental around our bodies must be a huge shift for a lot of your clients.
I would agree. I think it is a big shift. And that's where we need supports because, if you see me, if you're fortunate to come to my medical building and see me, you might see me 4 times, maybe 10. A lot of people will see me up to 13 hours. And that's a standard that Medicare will reimburse for. But life has a lot more than 13 hours. I mean, you think about a year.
Yeah.
I mean, that's a long time. So what are the supports that we have in place between sessions? And I think that, to pay and acknowledge the effort that you and Glenys are doing to, put out podcasts that are providing support And I think podcasters have really done a tremendous service because there's a lot of great podcasts out there that can really help us keep that compassionate voice alive, that message to turn around and say, wait a second, I have a choice here. I could beat myself up, or I could just take a deep breath and remind myself that I'm human like everybody else on this planet. I have a
Yeah.
choice to care for my body, to provide and nourish my body, or to fall into despair or to fall into anger and punish. So either do nothing or punish my body. And that's where these conversations, where these supports, where we can go back and listen to them and say, you know what, actually, I don't want to beat myself up anymore.
Yeah, it's a huge change in mindset. Absolutely.
It needs a lot of support. And so I really appreciate all that you guys are putting out there, whether it be in print or through interviews. But we need a lot of support to change and friendships. We need a lot of friendships. And of course, the friendship I'm encouraging everyone to have is a friendship with ourselves. But sometimes we need a friendship with other people before we can really be friends to ourselves.
You know, it's one of the things that we talk about in our the groups I'm running with Rebecca Scritchfield for diabetes is, you know, we give sort of a basic overview of nutrition just for people who haven't heard it, but a lot of people say, like, we know basic nutrition. We know what we're supposed to do. That's not the problem. And we're like, yeah, we know that's not the problem. It is the shame. And once we sort of start talking about the shame and the self-compassion and making changes from a place of self-compassion, it's amazing to see people, like, light bulbs go off for them. And they're like, yeah, I could try that. And we realize, like, you know, the treatment for diabetes it's not a lack of education that people are suffering from, right? It's like people know what a healthy diet is. I mean, I hesitate to use the word healthy diet, but people know what a nutritionally balanced diet is. They know they have to eat fruits and vegetables and fiber, and, you know, they know they have to sort of eat consistent amount of carbs throughout the day, that kind of thing. It's not a lack of education that's blocking them. It's the shame and the fear and the lack of self-compassion. And so once we really start digging into that compassion piece, it's amazing what changes for people. And I think, unfortunately, as dietitians, we're not trained in that part in our education, in bringing the compassion in.
No, I don't think that we are. I would kind of offer a little twist to what you said, though, Glenys, which is,
please.
I actually don't think people know what good nutrition is unless they're dieting. So they only know what restrictive eating is. I really don't think people know what good nutrition is.
That's a great point.
I think they can tell me how to, like, I can tell you what a good diet is, like a restrictive eating plan. But for me to turn around and say, like, what would be an amount of food where you feel satisfied and you feel like it's balanced in energy and it really makes you happy to eat that? Like, what would that look like? And they're like, I have no clue.
That's a great point. And I think what some people are saying to us is, we've heard all of this diet information and we're like, we're not giving you diet information. We're talking about adding foods in, and how do you do that? And people are so traumatized by their past diet history. And I would say most of our group members have had that past diet history. They're so traumatized by it that it's difficult for them to see nutrition in a different way that isn't restrictive.
And that is something that resonates very loudly with me. And if I can share a story, one of my clients who I absolutely positively love came in. So she came in and she said, I'm looking for a total Control-Alt-Delete to my brain. And that's how she phrased it.
Reboot.
She goes, I want to reboot. I want to Control-Alt-Delete of everything that I know about food and nutrition and she said, I am just done. And I said, so you're ready to leave diet culture? And she goes, yeah. I said, because you don't like swimming in the cesspool. And she's like, that's what it is, isn't it? I go, yep, it is a sewer. And everyone else is in there with us and we're all swimming around thinking it's clear water, but it's not. And that's it. So diet culture is the septic tank. You know, we're all swimming in this, and we have to get out of that because that has nothing to do with nutrition. restricting your intake, feeling physically hungry and not nourishing your body. And this is physical hunger. I mean, your body is giving you cues and not responding or not knowing how to respond or not feeling like you're allowed to respond. That is playing head games with you. It's just crazy how it can mess up our brain. We need to get out of that.
Absolutely.
These are great tips and I think so important for, especially with this context. I mean, we hear a lot about mindful eating. We hear a lot about diabetes, but not like sort of the intersection of those two. And I think it's so important, this work that you're doing and providing this education for us.
Well, thank you.
Well, it was so great to have you on our show. I know I've been wanting this for a long time. So thank you so much. I think people listening will feel like a collective from everybody in listening. We're like, I feel less worried already, which is great. That's what we want to do.
It is what we want to do.
So where can we learn more about this online? Do you have any resources either that you would recommend people to find more information about you and some of the things you do?
Well, thank you for offering that. I do have a lot of different resources. Majority of the resources and services that I offer are for professionals. But Dr. Michelle May and I wrote a book called Eat What You Love, Love What You Eat with Diabetes. The first edition, I think, is a little bit more steeped in diet culture. And so that was why we rewrote it and provided the updated edition. So the 2017 edition is what we recommend and ask people, even though it may be cheaper used, it's probably not the right book for you. So we do have that resource available. And that program is also in August, we're relaunching, again, just redoing that as well. It's a training program, an online training program for consumers. I do a lot of training. So I have a book called Diabetes Counseling and Education Activities for Professionals. And I also have only for professionals a closed Facebook group as well. And that's just because there's so many people with elevated blood sugars. That's 100 million people. Myself and Glenys can't do it all. So we need to train professionals. And that Weight Neutral for Diabetes Care Facebook group is a mixed group of professionals. It's absolutely free. And it's my passion to help other healthcare professionals really embrace this health at every size approach and really let go of the judgment. And it does take a collective. We do need to learn from each other. I offer a lot of different CEUs and webinars and those kinds of things for professionals. So the easiest way to find out about those is to go to my website, megrette.com, sign up for my newsletter. But even if you don't want to do that, just start really making the decision to let go of diet culture. And that's set that intention to just say, you know what? I am going to let go of diet culture. I'm going to let go of restrictive eating. I'm going to see it for what it is. And if it hasn't quite sunk in yet, keep listening to these podcasts. Keep finding people that are promoting this health at every size message so you can get really clear what it is. So that's my suggestion.
Well, thank you so much for being on today. It was a pleasure talking to you. And I know I have learned a lot, and I know everybody else has learned a lot too. So thank you so much.
Yeah, thank you.
Yeah, it's been a great pleasure here. And I've been listening for a long time and just really value all the wonderfulness you both are putting out into the world. So thank you.
Thank you so much. Well, we'll talk again soon.
Okay.